Hi, all. Thanks so much for joining. Speaking of making healthcare work for you, I'm Stephanie Fields, and today I'm joined by my co-host, Dr. Apoorv Gupta, and Jaclyn Wainwright, who is the CEO of AiRCare Health. So thank you so much for being here.
Thanks for having me.
And Jaclyn, tell us, AiRCare Health deals with mental emotional health. How have you been helping people, particularly through the pandemic?
Well, we are primarily a solution that provides mental and emotional virtual support to healthcare systems or employers. So we actually have been playing a big role in helping support frontline healthcare workers cope with what's going on, manage some of the new stressors, prevent burnout for those that are actually coming in and day out and dealing with the fear of working in a pandemic. So it's been really unbelievable to be able to show up and serve a community in a time of need.
That is so fabulous. I love that you're able to help support the healthcare workers during this time because that has to be just unprecedented times for everybody, but it's so scary for those people who are dealing with a pandemic. You sign up to be a frontline worker and you know you're going to be dealing with illness or potentially contagious things, but you don't really probably expect this. Who would have ever expected to deal with a pandemic?
Yeah, and I think what's interesting is that it's not necessarily that this type of thing they hadn't imagined would happen, right? I think it's that there's two types of stress that are happening here. We're experiencing this intense stress, which you would expect with some type of pandemic, but the piece that's not expected is the prolonged stress, the fact that it doesn't go away. And so I think that's the piece that is really weighing on people, and not just healthcare workers, weighing on moms, dads, brothers, sisters, mothers, you name it. All of us are experiencing this sort of fatigue with the prolongedness of COVID and the impact of having to live through that day in and day out.
How do you help people through that?
Well, I think part of it is giving them a place where they can be honest, right? Where they can, oftentimes just say out loud, "Gosh, I'm really struggling," or "It's starting to get to me, and I don't know what to do," or just listening is oftentimes the first step in trying to process, right? Acceptance that you are experiencing something new and different. And so I think we give them a place to talk about how they're feeling, but then also I think we give them some education around how they may be experiencing these things and why. So a little bit of science, because I think, at least for me, what I've learned is that if I can understand maybe why I'm feeling the way that I am, or that I'm not alone in the way that I'm feeling, it helps me to be less ashamed, I guess, about what I'm experiencing, and be more open to changing behavior or looking at something a little bit differently. So I think, there's a lot of reasons why one may be struggling. We've got a lot of good reasons, right? The isolation, the fact that just about every facet of our lives has changed. And so, first of all, trying to understand and process which one of those things is causing the most pain or suffering or disruption, and finding a way to give them some coping tools or skills to move through the day and get beyond it.
Is this like a coaching session or a counseling session?
It's not coaching or counseling. I would say we do use licensed clinicians, so there is a little bit of therapy or counseling going on. Depends on the situation, though. So we always use licensed clinicians for that reason, in case there is a moment in which we need to be giving some intermittent therapy or using coping skills. But it's a little bit of coaching, resourcing, counseling, solving problems, listening, all built in one. So we try and make it a one stop shop in terms of what that person on the other end of the phone may need to get well, so that we're not having to pull in multiple providers in the moment, so that somebody can have that one person that they can connect with on a regular basis, that can maybe um, you know be the person that is connecting them with the other resources, and be the one that is helping them in the moment, so they only have to make one phone call, or they only have to pick up one phone call to get the solution.
I'd love to talk about some of the findings that you shared that you've seen through your research over this time. You've found really fascinating things about loneliness, the markers of daily life, and then you already talked about the stress, the prolonged stress and the intense stress. But can you tell us more about either the markers in daily living and the loneliness?
We knew that loneliness had some health implications, physical health implications on people long term. But I don't believe that we knew as much as we know now about loneliness and how it can impact physical, mental, emotional health in regular, not just elderly, but all ages, all people. And so I don't know if our listeners have heard the statistic that loneliness or living alone and poor social connections is as bad for your health as smoking 15 cigarettes a day. But
Mm.
that to me is a very compelling statistic. We hear so much about smoking and the impact that that can have on your physical health. But to think that living alone and being lonely can do the same type of physical damage is astounding to me. I mean, it's one that makes you stop and think about, connecting with others. So that is really interesting, as well as the fact that it puts people at greater risk of cognitive decline and dementia, so that not having that interaction can actually create cognitive problems for individuals, which is, it makes you think about what we will be experiencing as a society long term because of the prolonged isolation that many people have been sort of forced to live through.
Can you reverse loneliness, the effects of it, like you can with smoking if you quit? And then do people always know that they're lonely, or do you think there are people who may be suffering from these effects and they might not even realize it? They might think, I'm fine, I live alone, I can handle it, it's no big deal.
So I'm going to tackle the first one, the question about, do people know when they're experiencing these things or not? Because I think it's really important. It's a really important element of understanding why and how people may need or receive help. Um, the first thing is that with most mental health conditions, depression, actually many of them, almost all of them, you feeling the inability to follow through, the inability to connect with others, those are symptoms of the disease. So it's almost this catch 22 where you now, because you have, an underlying condition, or you're depressed or even clinically depressed, you have an inability as a symptom of the disease to reach out and ask for help. You
Mhm.
also are have an inability, or you follow through less with those elements of the care plan that you maybe would otherwise. So there's a low engagement that's built in as a symptom of having that underlying condition. So I think part of it is symptom of the disease actually prevents people from recognizing or reaching out. I also think there's a lot of societal sort of stigma. There's a lack of access. There's all kinds of reasons why people may tell themselves, you're not feeling that way, or it's not that big of a deal, or if you could just get through the next 6 weeks, or whatever markers we sort of tell ourselves, or sort of deals that we make with ourselves. Those things can actually prolong people from getting the help that they need.
How often are you able to reach people then? You're calling them. Are they ready for that call? Are they still willing to talk to you?
It depends. We have noticed that during the past 8-9 months, people have been a lot more willing to have the conversation. But we look at it as, if they're not interested or open or ready to receive the service when we call them the first time, that oftentimes it sort of plants this seed, and it's with them whether or not they're consciously thinking about it. So
I
there's
see.
a lot of data science behind how, why, when we reach out to people. And so we try and, you know, give people the opportunity to say yes.
Go back to the findings that you mentioned and talking about the markers of daily life, the markers in time, and how people gauged things. Tell us about that.
Yeah, so there's some really interesting studies that are coming out around how COVID has impacted the way that we as human beings mark the passage of time. And so, if you think about, you think about your life and you think about those moments that have gone by too quickly, or those things that you felt like dragged on, that's an emotional response that you're having to whatever it is that you're experiencing. So, say you go to a concert and you felt like, gosh, that went by too quickly. I had such a great time. I really wish that I could have had more time enjoying that concert. So your emotional response of really enjoying and being engaged in that experience makes the time pass quickly. When you are sitting in, say, a class that you're really bored, or you're stuck at a meeting, or you're doing something you really just aren't enjoying, that seems to drag on, right? The passage of time sort of slows. And so without these markers of passage of time, without the variability in our schedules and the activity and the stimuli from the outside world, the passage of time has felt, some people describe like it felt like a year when we were going through it, but they look back and it's gone in an instant. And so this idea that our concept of the passage of time has changed is something that I think people are studying, or are really interested in studying, because it's impacted us as a society, and probably will.
Do you think that people are experiencing the passage of time more slowly now or more intensely?
I think that people get this fatigue around, so this
Mm.
exhaustion around prolonged stimuli that is provoke has a stressful response, or your body has a stressful response to. So we become exhausted, right? We become disillusioned, right? We disconnect. And it's actually leads, as a human being, leads you to this helplessness, or this state of depression, this hopelessness. And there's a term for it called learned helplessness,
Mhm.
in which people can get this feeling that you try and you try and you try, but nothing seems to give you the relief you're looking for. And that can lead to depression. It can lead to lots of, mental health and physical health problems. And so I think that, you know, we're learning that we need outside stimuli. We need human beings can't just have a mundane sort of a non-experiential passage of time, or there will be long-term effects on our mental and emotional health. So it's, how can you create, well, understanding how you are experiencing the passage of time during COVID, and trying to create moments of enjoyment, or a break, right, from this daily grind that is everybody's experience, this heightened sense of helplessness.
How do you do that? What are some of those ways that people can do that?
The first thing I would say is, if you are feeling isolated, lonely, helpless, scared, like you don't enjoy things anymore, say something, right? Don't just keep that bottled in. Talk to someone, anyone. And then, secondly, I think a few things. There's a lot of science behind the fact that other centeredness, or devoting time and energy to someone else's cause, or something that's meaningful to somebody else, releases endorphins. It brings, happiness to both individuals, and it gives you a sense of purpose. So I would say, do something for somebody else. If you are feeling like you're internally focused and you're having a hard time getting through the day, call up your mother or your brother or your sister or a friend and say, what can I do for you today? Is there something that I could do that would help you? Right. In that moment, that time that you're going to be spending on the other person, I guarantee will bring you the same sort of release, or endorphin rush that you'd get from doing something like going to a concert, or something else that you would enjoy. It's a fascinating, your brain has a very fascinating response to that.
It's such a great response, Jaclyn, because I love the idea of doing something for someone else. But I want to connect this back to the point you were making earlier. When you're in the grip of this disease and now the symptoms come and the symptoms make it worse, where do you start? Because now you're already losing motivation, losing interest, losing engagement. And yet we're here, we're giving them, tips that they can probably recognize this makes sense, but I've already lost my momentum. So what's that baby step that somebody can take to just start taking some control back?
What we know is that you can't just inject something new into your routine and hope that it sticks, right? So we tend to be people human beings replace things. So if you have a habit or something that you can replace with something different, that's what I would recommend doing. So in the morning, if you have a routine, and that routine includes doing the same thing every day, right? And I would replace some portion of that routine. Say, if you're virtually working, I would say after every meeting, you should set down your headset or walk away from your computer and take a lap around your house or a lap around the room, or give distance, proximity, instead of being in front of the screen. That little bit of distance, the walk is going to help get your, blood flow moving. But try and change your routine in small positive ways, and see, that would be the first step, right? So and pick one thing. Don't pick 10 things. Pick one thing and try it for a week. There's lots of different tools, from breathing and grounding and meditation to movement and conversation. I would start with one thing and give it a try and see if it helps.
You're a mom of several children. What are some of the tips that you would tell parents, or how do you keep an eye on this in your own house and try to make sure that your kids are doing okay during the pandemic?
I am by no means a perfect example of a parent. In fact, in a lot of ways, I'm probably part of the problem most days. I'm, uh, trying to make things okay when really I should be just letting them experience the world around them. But, there are some things that I think my husband and I have tried that have worked. And one of them is checking in at dinner time, having a family dinner every night, making sure that that routine doesn't get disrupted, and going around and sharing over a meal a highlight, low light. So this idea that good things and bad things happen every day, and let's start paying attention to both, right? Like, what happened, what did you fail at, or what didn't go well, and what went really well, so that we can, have those markers for them in development of good and bad, or those feelings that instead of being static, get them thinking about those things. And so that obviously starts with us doing the exercise, because they'll learn, from us. And so that's been interesting to go through and think as an adult, okay, what was my highlight and my low light of the day? So we've done that, and that, I think, gets a conversation. It opens the dialogue, right, for us to understand what our kids are going through, and where their pain points are. And I think, for my kindergartner, that's very much a social, physical. I don't get to see or have play dates or do the things that I used to be able to do. For my you know fourth grader, it's very much around social development and interaction, right? That whole idea that I think most fourth or fifth or sixth graders go to school, but for the social element, right? That interaction with their peer group. And so, there's a lot of just trying to navigate that. And how do you do it in a pandemic? And what's the right decision? And, am I ruining my children for life? All those normal parent related worries.
Jaclyn, what you're saying is this is reality. We're all experiencing it. But if you can learn your way into helplessness, obviously it sounds like the positive message that you're trying to communicate to us. Like, what I'm picking up is you can learn your way out of that as well.
Absolutely. I
And
would tell you that hopelessness,
mhm,
nobody deserves to be hopeless. It's
mm,
a terrible place to be. In fact, it's why I'm here. I think I found, I work at this company. I believe in what we do because I started as an intern here. And what I heard on the other end of the phone when I worked, nights and weekends, was hopelessness, helplessness. People had given up on themselves and others, and as a result of, trying and trying and trying and not getting the outcome or the answer they needed. And so I would tell you, we've taken, hundreds of thousands of people back from hopelessness, and that nobody should be deserves to be hopeless ever. And so I would say that that's not okay. It's not okay for you to feel that way and not say something, because
mm,
that is you know that's exactly what will feed that hopelessness, is if you keep it all
mhm.
bottled up inside. And there's absolutely a way back.
What do you tell people who might be new to really seeking help? Because mental health has always been a concern. That's not new, but the focus on it during COVID is heightened for sure. So, what about people who may not have been open to it before, but now we're hearing about it constantly, and they're starting to just open up a little bit and realize, well, maybe I could talk to somebody. What are some of those things that you would do to encourage people who might have been resistant in the past, but are now just starting to see that little glimmer that talking to somebody or calling somebody might help?
Everybody's worth saving. That's one of my favorite, just mantras, is that every single person on this planet will have a time in their life when they're struggling. And I believe that they're all worth saving, and that they can be saved. And so everybody deserves that, in my mind, and that they're not alone. That I guarantee that it's not the first time we've heard that unique or very personal story or situation, and that thinking you're unique or that your situation is unique can be uh, a really bad thing. So you're not alone, and you're not unique. Everybody, it's human nature to respond to crisis in different ways, right? To be stressed, to experience stress. It doesn't make you less than, it doesn't make you weak, it doesn't make you, in fact, I would say that asking for help is one of the most courageous things that an individual can do. And so really that's it. You're not alone. Everybody is worth saving, and asking for help is the most courageous thing that an individual will do in their lifetime.
Yeah, so inspiring, Jaclyn. So what I'm wondering is, the community in Minnesota is so grateful, I think, to have you. What do people do in other communities where there may not be an AiRCare? Are there other providers out there that might be able to help them?
We're actually a global company, so we could help any community if they're interested. But I think there are so many. We are not the only answer, right? And I think one one really great example of that is that there are many partners that we leverage, or that I think any solution will leverage if they're doing things in a comprehensive way, to get people the help that they need. There's not one size fits all answer. There just isn't. So I would say there's lots of opportunities to get into therapy on your, the modality that you prefer, right? Texting, in person, virtual, face to face, video. Talk to somebody, and we certainly don't have do not have a monopoly on that. There's lots of ways to get that help. I would also say that learning sort of meditation and breathing and some of those fundamental, sort of eating, sleeping, activity. Those things there's a plethora of awesome providers helping people building those skills, apps and in person and otherwise. So I would say it's going to take all of us as a community to come together and help one another, to be our best versions of ourselves. And so I would say that, the first step would be to reach out and ask for help. And I guarantee that there is someone there waiting on the other end to give you what you need. You just have to ask.
This is obviously such a strong personal mission for you. What is the one thing that just comes from the bottom of your heart that you want to tell people about the work that you do and why it matters?
I think it comes down to, it matters because they matter. I think we have a way of putting ourselves last sometimes, or minimizing what we're experiencing. And I think every human being, every human life is valuable. And I think that what we are trying to do is get others to understand that, to put that first, to put their emotional and mental health first, because they do matter. I don't care what neighborhood you live in, or what community you come from, or what religious background or political affiliation. You matter. And stop putting yourself second and start putting yourself first, because if you don't put your oxygen mask on, you can't save the person next to you.
Thank you so much. That's really inspiring. All the work that you do is so inspiring. I love everything that you're doing. AiRCare Health has on a really important mission, and I know it's important to you personally. So thank you so much for being here and sharing your thoughts. And thank all of you for watching. Bye.